Assalamu alaikum. I'm Sadia, psychotherapist and counselor, and I have Urfana and Ayishah with me today.
Alaikum assalam, Sadia and Urfana. For those of you who don't know us, Sadia here, Urfana here, and Ayishah here, we are members of MCAPN, which is Muslim Counsellors and Psychotherapists Network. And we all are professionals in with our quite a lengthy experience serving community, but not only Muslim community. My name is Ayishah, and I'm based in Birmingham, but after COVID, I think I'm more based online than anything else right now. And predominantly, I work with Muslim community. My work is based on Islamic ethics, but also CPCB program of counseling and psychotherapy. Urfana, how about you? How would you introduce yourself?
Assalamu alaikum, everyone. My name is Urfana, and I'm a counselor based in Bradford.
Hey, thank you. Nice to meet you all. So our discussion today is about therapist in therapy. So what would you like to say in today's discussion?
Nothing, it's a secret. Confidential.
We're going to share our secrets today. Yeah. I think there are many myths about counselors offering counseling. They don't have any issues, or they don't need exploring their feelings. They don't have any problems, and they are there on that seat to help others. So I think the main purpose of this talk today is so we can break those myths, and we can talk about our personal experiences and share between us, so you can benefit from our video today.
Absolutely. Yeah, I mean, therapist is human, and obviously we go through a lot of tests and trials in our life, and it's okay to have personal therapy. But sometimes, often people, they say, oh, you are a therapist, so you know everything. You know how to fix the problem, so why do you need a therapy?
Yeah, it's a very common comment I've heard. You know what I mean? You know this. They will think that I actually know everything, which is not correct. And I'm going to say this in front of the camera to all of you, that we are also human beings, and we also have similar emotions like you have. And we also go through different trials and hardships where we need counseling, where we need support. And it's very normal to accept that help.
Absolutely.
And I think it's a case of us being in habit of being in personal therapy as well. But I mean, before we ended up helping people, we had to go through hours and hours, and sometimes even year after year of personal therapy. So to us, it's a second nature, I think. Before we sit there and work with you, to us, there's no taboo, and it is ethical to continue personal therapy. It's also okay to change personal therapists, because with your self-awareness and with level of your needs, you're finding yourself that you need different interventions as well. So it's not a case of taboo, but yeah, we do have our shrinks, and we speak about it openly, but I don't think we treat it as a weakness. I think we treat it as a personal development, if I can speak for all of us. Does it make sense?
Yeah, definitely, Ayishah. It's the personal development, self-awareness. I see that more as a self-awareness, that I'm aware of my own self before I could be there for others. So that's a lifelong ongoing process. So it's not that when I qualified, when I was training and I was a trainee counselor and I thought, okay, I need personal counseling now. No, I think I need it more now, because I deal with so many clients daily basis where there's so many aspects which actually touch me and my feelings. And you go back and it's part of your self-awareness and self-development and self-care, I would say.
Absolutely. So, like, we carry people's emotional burden. And this is very unique profession, because we cannot share with our husbands, our colleagues, or our friends, or this and that happened, and my client brought this and that, because of all the confidentiality which we have to take care of. So for that reason, we need someone who is professional and in our field, who understands like what is going on, how to be a therapist, and how to carry the burden and all. So I think for that reason, definitely we need therapy. And I was just wondering that what do you think? Do you think as a therapist now, like a practicing therapist, do we need therapy on regular basis, or when we go through some difficult time in our life, any phase which is a bit difficult, then we should have therapy? What is your opinion on that?
I think first of all, as a therapist, giving everything that you already mentioned, Sadia, and it's difficult to add anything to it, because it is very heavy what we do, heavy what we carry. So I think the bottom line is, if you don't have a personal self-care plan, if you don't prioritize your time with yourself, you're not going to be efficient as a therapist, and you're not going to fulfill that that right to your client. So there are different probably activities that we do for personal care plan, and one of those is personal therapy, but also supervision, because we discuss different things on supervision and different things on personal therapy. And I don't know how about you, but my supervisor, he's got habit to say to me, you need personal therapy now. So it's like you can't escape that. And then you have your clients coming to you, doing this transference, contra-transference, mirroring effect of your own life and your own issues, which very often we think, or I think that, okay, I've dealt with that. Why are you coming to me, reminding me about it? Well, because it still hurt us. So we sort of have to revisit that.
Yeah.
And I think that's normal. I think that's science, transference and contact transference. So I don't know, what is your experience of those?
It's true, Ayishah, because now I'm a clinical supervisor as well, and even my trainee or my supervisees come to me, and when they bring an area which I feel like, yes, we are having supervision, but there is a part where you need personal therapy. So I say the same to them, that actually I think you need personal therapy for this area what you're bringing, because it's not part of your, I mean, we can touch upon this, but we cannot explore this in this supervision. And I think it's an ongoing, as I said, like Sadia said about emotional labor is something. I see this whole profession, it's very unique, very rewarding, and I'm like, I would say that I'm so lucky, I'm so privileged to be in this profession. But the truth is that it is very, very heavy work. It's very heavy work. It's your emotional labor. It's not a physical labor where you go to office and do, where there is a file work. There is all sorts of work. All the work have got their own dimensions. But this work is all to do with emotions. So when you are working with emotions all the time, your own emotions needs looking after. And there is no other way than having personal therapy. And again, is nothing negative about that. And about sharing that I'm having personal therapy, I personally think that is something you do for yourself, for your self-care. And we need to encourage everybody. I personally think everybody needs therapy. Not because I'm a therapist and I'm saying I'm promoting my profession, but I think the way the world is going on, recently after COVID. I personally think everybody should have a therapist. That's my view.
No, that's right. And also, if any trainee is watching us, I would say that, it's okay to, accept that we as a who is already trained, that yes, we do need therapy. For example, like if there is any ethical dilemma. For example, if you have a client who is going through a lot of, something not really pleasant is happening with them, tests or trials. For example, if there is a child, involved, and me as a therapist, then I have a dilemma to choose between, two not very pleasant kind of outcomes. For example, like I might have to report a child abuse, and I also have to take care of my client's emotions. So, sometimes you feel like, okay, there's a guilt or something like, am I doing something for my client? And then I have to go out of the therapy room and go and report something, like a child abuse or something. So it is like, for me, that was one of the experience which was quite upsetting for me. So I really definitely needed therapy then. So
I'm listening to you, sisters, and I think it's more than just emotions that's flowing up in the session. There's more that clients bring to us in terms of personal challenge than just emotions. It's also the memories, and sometimes we're being challenged with our own thoughts. Not necessarily only about the life itself, but also the religion, because we're working predominantly with Muslim clients, so they all coming with their own understanding of religion, and sometimes you're saying to yourself, oh, subhanallah, I'm so glad I walked through that. I'm so glad that I'm not in that predicament. And sometimes you think to yourself, oh, I wish I could be where she is. This is so inspirational. Who am I? Who am I to sit here and advise her? Have you been there before?
Yeah. Many times.
True.
Many times. It's true. Yeah.
And what is your opinion on having a therapist from similar cultural background? You talked about religion and seeing Muslim clients, so I think it's very important to have for me, it's very important to have a therapy or a therapist who is from similar, cultural and religious background. What is your opinion?
I think I had really good experience with not the similar religion or the culture. Okay. And my supervisor is also not from my religion or culture. Okay. But I think there is the most important thing I felt was the connection I had with them. And in certain situations, I understand that's an added understanding. If your counselor is from the same faith background, from the same culture, it does help to understand or explain. So that is definitely an added factor. But I personally think the whole relationship is based on that connection, on the
therapeutic relationship.
Therapeutic relationship, yes. Yeah. I think because I had a good experience.
Yes. Perhaps that's why you're saying
that. That's why I'm saying that. Yes, it's true. I still have really good relationship, and it's not that I really looked for somebody who's not from my culture or is from my culture, but I think I've been lucky. I've been really lucky with my supervisions and my therapy, and both were not my culture and not my religion.
Okay, that's very interesting, because we all, I think, have different experience. So
yes, definitely.
I was a trainee psychotherapist. My experience was totally different to yours.
Okay.
So, I had my personal therapy with, it wasn't from my culture or my religion background. So I had not really pleasant kind of experience.
Mm-hmm.
And now when I look back, I would say that I wish at that time I would have thought more and could have found a therapist who was, sharing the same beliefs or culture that would have been more helpful for me. So that's my personal experience. So we all have our personal
Different experiences, yeah.
What about you, Ayishah?
This is a really good question, and it's good. Yeah, it's good to differentiate bad experience from good experience, because that doesn't reflect the therapy. Therapy is a remedy, right? And it's for those of you who are listening to us. I think I want you to remember that not every therapy is the same, right? Not every therapist is the same.
Yes.
From my experience, I changed my therapist. I've changed their approach because I want to experience myself differently. It's not to say that I didn't get enough, but I'm driven by the attitude that there's always something I haven't learned about myself. There's always a method, an intervention which I haven't experienced. So if I experience something that works for me, then I go and I research it, I train in it, and then I introduce it into my private practice. So I use myself as a guinea pig sometimes, to the great benefits to my client work, to my clinical work. But I had bad experiences, and I'm happy to share them. I'm sharing them in my class when I teach my students, and I can share them here online. I mean, my first experience of counseling was when I was sitting there with the Muslim counselor who was ex-Muslim counselor. She decided to leave Islam, and she sensed very cleverly something in me that I was holding back. And I explained to her, I am revert. This religion is important to me. I understand you have understanding and cultural experience of living in with Muslims, among Muslims, so I don't have to explain myself and I can connect to you. But you left Islam and I came running to Islam. So I think that therapy might not be as effective. So we had this open conversation with the counselor, but I felt emotionally manipulated by her to stay in, because she said, "Oh, if you stay with me, then you have 3 months of waiting list. So what do you want to do?" So that was very unethical. And then I have my colleague who says that she decided to be a counselor. She's a Muslim sister only because at her times there was no Muslim counselors, and the explanation that she was getting from her non-Muslim or non-faith trained counselors, let's put it this way, because times has changed for us in this profession, we know now. She had advised that the only reason why she has depression is because she's wearing scarf. So this is quite appealing, and this is I think still a possibility for all of you who are watching, who are taking therapy, to be burned by therapy, to be disappointed with therapy. But it doesn't reflect therapy; it reflects the therapist training and ability to all her lacks and faults. I think it's really important to mention. I don't know if you had such a drastic experiences like
I think very good points you made, and I would like to add that if any trainees are watching us, and some of them or all of them probably are in therapy. So anytime if they feel like stuck or they think that they're holding back, they should have that discussion with their therapist. This is from my own personal experience, because I was holding back a lot and I didn't have any discussion with my therapist. So don't hold back, have proper discussion, honest discussion with them. And if it's not working for you, it's okay to go and find another therapist.
What Sadia has just said, actually, I did that with my supervisor, because there was some issues I was bringing and they were religious based. And I was very open and honest with her. And I said, you know what? I connect with you. I feel these sessions are really useful, but there is something in me which is, I feel like if you were a Muslim practitioner, it would have been easier for me. And then she was so happy to actually explore that. And I didn't keep it to me because I felt like it will not be useful for me to carry on having the sessions where the issues are, if the issues are faith-based, if I'm taking something which I feel the other person will not fully understand, then it will cause me problem. And I think what Sadia has made the point is, be open and honest. Yes. And you have to change, then you can change. But because you need to make use of that time and you want to get something out of that session and therapy, then it's crucial that your therapist is somebody you can connect, and what you want to achieve from those sessions, if they are faith-based, like I feel, alhamdulillah, MCAPN is doing a great job. When people are emailing or inquiring, they are actually asking, they are saying, we want somebody from an Islamic perspective. We want, it's not that we don't cater the rest of the communities, we do that, but specifically for the Muslim counselors, for the Muslim the clients who are looking for Muslim counselors or therapists, I think the network is the place where you can come and join us, look for us, and clarify what your requirement is. And I've been getting those inquiries where people are very clear. They are very clear what they want. Rather than, like, if I look back years ago when I wasn't clear, I didn't know, and I think it has changed as well. I think it's a lot more to offer now. There is, these directories are offering you Muslim counselors. Before, I don't think it was the case.
Yes, yeah. I think when I started, I couldn't find any directory where I could choose. There's like you said, MCAPN are doing great because it's a directory and people can come and look at your profile and they can choose accordingly, like what they're training, either what
their requirement is. Yes, yeah. It's made it easy for people.
And I would also say, for all of you who are considering personal therapy, with us or without us, it is your right to speak to the therapist. Not only, check them out on their website, and on YouTube or on directory. It's your right to speak to your therapist. If they advance in technology, they can, and if that's what they offer, like I do offer free 15 to 20 minutes first meeting. And it's your right to see if you can connect with a counsellor. That wasn't the case before. You've just had and you just had to get on with it. So if you are at the stage when you feel you need to move on, make sure you choose the right guide. And it's your right to window shop. It's normal. It's really a decision, to choose somebody to work on your things.
Yeah, I think it's very, very important what Ayishah said. It's your right. You can, because you are committing to something, you're making a major decision. Going for therapy is not a small decision. You need a lot of courage and a thought process to decide that actually I'm going for counseling. So I do the same. I offer about 10 minutes free consultation. So when you are deciding, when you are planning, you can ask all those questions in those 10 minutes to make sure to have the feel if I am the right person for you, and then book something, because it's not an easy decision what you are thinking about yourself. But do think about yourself, look after yourself, and it's your self-care. Like anything else, I always say to my friends and families, it's like you go and buy a shopping bag, you go and buy a designer clothes, you go for a restaurant meal, you can think about all those type of things, but your mental health is more important than your bags, clothes, and restaurants. So I always say, do think about yourself. And if you need this support, there is nothing wrong in that. We also go and get this support because we need it. And we openly, all three of us openly are saying that we require this support. We go and get it. And then if you think you are going through a time in your life where you need some extra support, then do go and look for a counselor and look after yourself.
Yeah, I think, what you underlying just at the end of our meeting, because we have 5 minutes left, is that paradigm shift, isn't it? I have a problem, I need a shrink, it's a taboo, there's something deficient in me. Where's me coming from? It's like, oh, it's so incredibly exciting to find out something new about me. Yeah, I might have an issue, but you know what? I really want to hear your view. I really want you to show me different points of view, because I'm always going to be limited. So, our attitude to personal therapy, if anything, help us to see it as a personal development rather than fixing or magic pill effect. And that change your paradigm. It's to know yourself better. It's the journey of falling in love in you, with all your goods and all your bads, with all your lights and all your darkness. It's okay, it's all right. You're never meant to be perfect, but by all means enjoy the journey.
Yeah, absolutely. And I would like to add the benefits of therapy as a therapist, as a professional. What are the benefits? I know we have just not much time left, but just quickly, the benefits are we have a professional who can understand us from the same background, and we can, unload what we, carrying with us. Also, they can give us neutral feedback, and they can, help us to see our own blind spots. Sometimes we do have, and we can't see them. Just like we try to show our clients, what are the blind spots, or would they like to reflect upon? So same for us. We can, we can have that. Also, opportunity to deal with personal issues, whatever is going on in our personal life, and also probably opportunity to manage our own issues and issues with the clients, which the triggers for us.
But I also think I can't fault any of those, but there's something deeper that's going on between you and your therapist. There's something more you're getting. The value that you're getting is nourishment to your intrinsic needs to belong and to feel special and to feel loved. And that's what the professional therapeutic relationship gives you. Someone who is a complete stranger to you can respect you, can hear you, can see you, can give you the undivided attention, respect, care, and nourishment. And that in itself is priceless.
Absolutely.
Definitely.
Without any judgment or any kind of holding back. They're just there for you.
Yeah. And it, on top of all this, I think it just helps you to, because for me, when I changed the seats, the 2 chairs in the counseling room, so I would love to sit on the counselor's seat, but then swapping to the client chair is also such a wonderful experience to feel for myself and to have more awareness and the feelings for my client on that chair. So I think it's the swapping of those chairs. It's a beautiful experience. Again, it comes with all the things what Sadia and Ayishah said. It's a huge, there is so much you can get out of those, those sessions that
it's very grounding. What I hear from it, that is very grounding, and it brings you
very grounding.
It brings you back to more respect to your client, because you becoming a client as well, isn't it? Well, ladies, we did came to an end. We have less than 1 minute. It was pleasure sitting here and exploring that subject with you. Shame we don't have more time, but you know what? Maybe it's just enough.
Thank you very much, Ayishah and Sadia. It was lovely time with both of you, and I hope our listeners, viewers can benefit from our talk today.
Inshallah.
Thank you so much, Ayishah and Urfana. Thank you.
Thank you.
Assalamu alaikum.
Assalamu alaikum.
Assalamu alaikum.